It's Lady Furnish here, and it's time for another great sesh. Just Blaze! I picked CBD for today's topic, and I'm really excited to answer your questions in hopes to educate those who are searching for an alternative to prescription medications. CBD is a cannabis compound that has significant medical benefits, but does not make people feel stoned and can actually counteract the psychoactivity of THC. The fact that CBD-rich cannabis is non-psychoactive or less psychoactive than THC-dominant strains makes it an appealing option for patients looking for relief from inflammation, pain, anxiety, psychosis, seizures, spasms, and other conditions without disconcerting feelings of lethargy or dysphoria. Scientific and clinical research, much of it sponsored by the U.S. government, underscores CBD's potential as a treatment for a wide range of conditions, including arthritis, diabetes, alcoholism, multiple sclerosis, chronic pain, schizophrenia, PTSD, depression, antibiotic-resistant infection, epilepsy, and other neurological disorders. CBD has demonstrable neuroprotective and neurogenic effects, and its anti-cancer properties are currently being investigated at several academic research centers in the U.S. and elsewhere. That's amazing, guys. Like, cancer. Who would have thought that we'd ever find a cure for cancer? It's such a terrible thing, it happens, it's starting to become very common. Further evidence suggests that CBD is safe even at high doses. CBD-rich versus CBD-dominant. Now I'm going to explain what that means. By CBD-rich, it means a cannabis strain or product that has equal amounts of CBD and THC, or more CBD than THC. Usually at least 4% CBD by dry weight. By CBD-dominant, it means strains or products that are CBD rich but have very little THC content. Now we're going to get into dosing. What's the recommended dosage for different ailments such as pain for diseases or cancer? It's only 1 or 2 drops in the capsules. Now, if you can go to your local apothecary, they usually sell bags of empty capsules, like 100 count or something like that, and that's how you make your pills, man. Fuck that man-made shit. We figured like extract and squirt it in there and just, you feel me? Up the dosage once a week until the capsule is completely full. And then taking around 2 to 4 a day. And then after 2 weeks, we gain back appetite, the pain reduced, the improved memory, increased energy, and migraines went away. What are ways to use CBD, such as ingest or topicals? So there's multiple ways you can take CBD. I like to dab. It's my favorite. But you can do oil extracts, like I was saying. You can make it into a liquid, which infuse sublingual, which means under the tongue. Sprays, capsules, edibles, patches, inhalers, all that shit. Those are all different ways that you can consume CBD and cannabis and THC. Dosing. Cannabis is personalized medicine. The right CBD cannabis treatment depends on the person and condition being treated. For maximum benefit, choose cannabis products that include both CBD and non-intoxicating compounds and tetrahydrocannabinol, THC, which is the psychoactive component of cannabis. CBD and THC interact to enhance each other's therapeutic effects. They work best together. If CBD is safe to consume during pregnancy, using any substance during pregnancy can be concerning. Everything that's taken into the body can have a possible impact on developing baby. Thus far, prenatal cannabis use isn't associated with an increased risk of birth defects or life-threatening conditions. However, medical researchers and professionals still have concerns. Compounds in cannabis have effects on the body thanks to the endocannabinoid system. ECS is a large network of cell receptors, cannabinoid receptors, and their corresponding agonists. Cannabinoid receptors can be thought of as locks, and endocannabinoids can be thought of as keys. ECS controls a variety of bodily functions such as mood, appetite, metabolism, memory, movement, sleep, reproduction, and immune function. The active chemical compounds in cannabis will interfere with the natural process of development, leading to potential trouble down the line. Though with research available thus far, it's difficult to tell to what end. There's not a whole lot of high quality information on cannabis during fertility, pregnancy, or breastfeeding. Cannabis is still considered a Schedule I drug in the United States, meaning that the herb has no known medical value. The herb's Schedule I status makes it illegal for scientists to research. We gotta fucking get it off of there, as well as illegal to possess, cultivate, purchase, or distribute in some states. When it comes to research on CBD and pregnancy, studies are few and far between. The majority of investigations into cannabis and pregnancy focus on psychoactive THC or generalized cannabis use. Here in Oregon, they don't care if you smoke during pregnancy until you hit last trimester. In your last 3 months, they like you to pee clean. Many mothers consider turning to hemp or cannabis products during pregnancy in order to control nausea, stress, and other unpleasant symptoms, but as medical professionals do not recommend the use of cannabis during pregnancy. Is hemp oil safe? The perceived blanket ban on plants of the cannabis genus, which hemp belongs to, as it is a non-psychoactive cousin of cannabis, may just relate to THC. A 2014 study suggested that THC exposure during pregnancy negatively affects brain development in both humans and mice, as fetal development involves many specifically timed signals and processes. THC may impair it in some ways. Cannabis has also been linked with low birth weight and premature deliveries. However, a review of research found that there was no significant risk of these when results were adjusted for factors such as tobacco smoking. Contradictions to the negative effects of cannabis in pregnancy on newborns. Contradicting the 2014 study is a 6-year controlled study on Jamaican mothers and their children. This found that the mothers using cannabis had babies who were not only free of impairment, but deemed superior. They were more socially responsive, less irritable, and more alert and anatomically stable. However, these better scores won 8-cell embryo a couple of days after pregnancy begins. Eerie calls by higher educational attainment and financial independence among users. 19 of the 33 users reported that it relieved nausea, improved appetite. 15 said that it reduced fatigue. Participants also stated that they found relief from depression and feelings of desperation associated with raising children in poverty. Follow-up research conducted in California also found no developmental problems in the babies of mothers who used cannabis. In addition, 3 women previously thought to be sterile conceived. Mothers were 8 times more likely to breastfeed for at least a year, and all gave birth naturally. The endocannabinoid system, a system of chemicals produced by our own bodies similar to cannabinoids and the receptors that respond to both, is present from the early embryonic stage. Even when an embryo is only 2 cells, it still has cannabinoid receptors. In a study on mouse embryos, THC but not CBD stopped the development of embryos that were less than 8 cells. However, on one of our own cannabinoids, many of the Jamaican women in the study above were Root's daughters, who smoked cannabis every day, including the earliest weeks of pregnancy. CBD might be better than regular cannabis. In conclusion, cannabinoids have been consumed by many pregnant women over the years to relieve uncomfortable symptoms such as nausea. However, using only non-psychoactive hemp is advisable to avoid addiction. It is also important to only use hemp extracts and other herb and supplements during pregnancy and prior to conception if necessary, and only to use them under the advice of a health professional. High CBD cannabis strains have grown in popularity over the past few years, which doesn't give scientists much time to examine the compound's postnatal effects in detail. Much of the available literature stems from cell line and animal studies, which may or may not apply to humans. However, this preclinical research provides a peek into the possible effects. Regardless of whether they are positive or negative, it's nice to know where things seem to be headed. What are the benefits of CBD? Scientific research now shows that many health benefits of CBD cannabinoid from the digestive aid. A healthy appetite is vital to a healthy body, especially when the body is healing. Some illnesses decrease the appetite to the point of preventing the body from healing itself. CBD stimulates appetite according to the National Cancer Institute. In the human body, CBDs bind to cannabinoid receptors in the body. Scientists believe these receptors play an important role in regulating feeding behavior. CBDs stimulate appetite when they dock onto these receptors. It also eases nausea and vomiting. This is especially helpful for individuals enduring chemotherapy and other treatments for serious diseases. Anxiety relief. CBD may alleviate severe social anxiety. Generalized social anxiety disorder, or SAD, is one of the most common forms that impair quality of life. Some consumers complain of increased social anxiety after marijuana use, but this may be due to low levels of CBD and high levels of THC. In 2011, scientists wanted to study the effects of CBD on people with SAD, and they selected 24 people with this condition who had never received treatment for SAD. The scientists then asked study participants to take part in a simulated public speaking test while researchers measured blood pressure, heart rate, and other measurements of physiological and psychological stress. The CBD group showed significantly reduced anxiety, cognitive impairment, and discomfort in their speech performance. In comparison, those in the placebo group presented higher anxiety, cognitive impairment, and discomfort. According to the National Institute of Mental Health, approximately 15 million adults in the United States have social phobia and about 6.8 million have a generalized anxiety disorder. Traditional treatment usually involves counseling and medications. Fuck that. Treatment with CBD may be better than antidepressants because it acts quickly and does not cause side effects or withdrawal symptoms. It helps with cancer, maybe a protective effect against the development of certain types of tumors. May do this by inducing tumor cell death, inhibiting cancer cell growth, and by controlling and inhibiting the spread of cancer cells. One study by California Pacific Medical Center suggests CBD turns off the gene involved in the spread of breast cancer. These scientists found CBD inhibits ID/1, an action that prevents cancer cells from traveling long distances to distant tissues. Anti-psychotic CBD relieves psychotic symptoms associated with schizophrenia, according to research by University of Cologne in Germany. Schizophrenia affects about 1.1% of the population, or approximately 2.4 million adults in the U.S. It continues to surprise medical researchers with the variety of common health benefits it provides. An increasing number of scientists, physicians, and consumers are learning about these health benefits and incorporating CBD, a healthy lifestyle plan. How do I know I'm getting actual CBD? If you're searching for a natural path towards health and healing, trust who you're going to, basically. Like, find a dealer that's trustworthy. I love you guys so much. Thank you guys again for watching, sharing, commenting.